Good morning, afternoon, and evening to the YouTube universe. My name is April Lynn Grubb. I am a senior level nursing student at Indiana State University, and I'm doing a learning tool today for infant safety, so children from birth to 1 year. Today's learning objectives, I'd like to be able to describe a typical medical well child visit, infant vaccinations, developmental milestones, common infant safety risks and prevention, and then resources for anybody who has questions about infant care. I have included a pre and post test to this video. If you would stop now and take the pre-test before we begin the lesson, that can evaluate if you've learned the right answers between now and the end of this course. So infant medical care, infants from birth to 1 year will see the doctor routinely for well child checkups. Now, that doesn't just stop at infanthood. We should see our doctor at least once a year from age 3 to age 18. Much like a physical, a well child talks about safety, sexual health, development and growth. That's very important to identify deficiencies early to protect your child. Most infants should see the doctor at around 2 weeks, 1 month, 2 months, 4 months, 6, 9, and 1 year. If there are any growth or development concerns, the faster that we can get on top of those, the better we have of changing the outcome. There, of course, are things we can't change the outcome of, but many developmental delays and growth problems can actually be rectified if we get a hold of them soon enough. So it's very important for your baby to see their doctor regularly. Most infants receive vaccinations at 2, 4, and 6 months, and then again at 1 year, and typically at 18 months and 2 years, and then not again until kindergarten. These are for common illnesses that used to cause infant death before we had vaccination. Common vaccinations I have listed here: polio, tetanus, diphtheria, whooping cough, hepatitis B, Haemophilus influenzae, a lot of people call it Hib, MMRV, which is mumps, measles, rubella, and varicella, which is chickenpox, Hep A, pneumococcal, rotavirus, and influenza. Now, rotavirus is an oral vaccine typically, and you and I, when we get rotavirus, we might just have a really bad stomach bug. You know, we might have vomiting and diarrhea, but for babies, they cannot sustain that vomiting and diarrhea, so it's very important to protect them from rotavirus during those early months when they just don't take in enough fluid to keep their fluid level up. Why should we vaccinate? Vaccinations prevent common childhood illnesses that lead to severe complications or death. Why don't we see that happening anymore? Because the advent of vaccines. What to know at 2 and 4 months. So at 2 months, you're typically going to see your baby start to smile at mom or dad, trying to look at things. They can coo, they can turn their head towards noise. They should be able to fully hold up their head. Now, it may not be completely steady, but they should be able to hold their head up. At 4 months, that's that magic age where baby starts to smile at everybody. They babble, they can reach for toys with one hand. They follow people around a room, recognize people or things at a distance. They may start rolling, so it's very important to keep them on the floor or on a low place. No couches, beds, countertops, or changing tables without direct, undistracted supervision. And at 4 months, they should be able to hold their head up steady. At 6 months, baby likes to play things like patty cake and peekaboo. They might just like to bang things together. They love mirrors, respond to their own name. They get very curious at this age, and they are just magicians at finding out how to get what they're not supposed to. At 1 year, we might start to see that baby cries without mom or dad. They start to have stranger danger. They still love to play those games. They shake their head no or wave bye-bye. They love to put things in and take things out of containers. They will point with one finger. That's actually a very important developmental milestone. They'll follow simple commands, and then they can get to a sitting position without help. We always say, oh, they're walking by a year. Not all kids walk by a year, but there are certain milestones that we're looking for by a year. Common safety risks, our top 4 are car crash injuries, falls, burns, choking, and suffocation. Car crash injuries, most can be prevented by having an appropriate car seat. Falls, babies are Houdinis. You can have a 2-month-old baby in the middle of a giant bed and somehow they manage to fall. I don't know how it happens, it just does. Baby needs to be in a safe place, on a floor, in a bassinet, in a crib, someplace they can't fall from. Burns, babies are great at grasping handles and cups and handles of pots and pans, anything that they can get their hands on. So baby and hot substances don't go together. Don't carry baby with your cup of hot coffee or hot chocolate or a dinner plate. And make sure your water heater is 120 to prevent tap water burns, because they will get a hold of the tap. And if it's 120, at least we can get them out fast enough before we get scald burns. Choking and suffocation, my number 1 recommendation here is to make sure that you learn CPR and infant choking procedures, because it will happen. Your child will choke on something. Make sure that you know infant choking procedures. Safe sleep, make sure baby sleeps in a safe space alone, like a crib on a firm surface, no pillows, blankets, toys, bumpers, loose fabric or any kind, just a fitted sheet and baby. So here's our prevention. Make sure you have a car seat and that you know how to use it correctly. I'm still seeing lots of people not putting the chest clip where it goes. It doesn't go on their belly. It goes all the way up on their chest. Make sure that it gets installed correctly. And there are police officers, there are hospital workers, there are all sorts of people out there who are trained to teach you to put it in correctly, so use those. Don't have your infants in the kitchen when you're working with hot things. Never ever leave a baby unattended in their bath or near a pool. Avoid water at all without a direct, undistracted attention from an adult, because adult supervision is not just enough now. We need to say undistracted, because if you're on your phone, that's distracted. Get all your vaccines on time if your child is healthy. Keep small objects, including like teething necklaces, which shouldn't be made for babies. Childproof your home for your baby's age. No, you don't have to have all the cabinets locked and everything ready to go when your baby comes home from the hospital, but you need to by the age of 4 months. And we need to work on stuff as they get older. You just start adding more and more things. Where can you learn more? Talk to your pediatrician. I really recommend getting a provider who is comfortable with children and who will answer your questions. And then I've included some reputable websites here. I'm not a big fan of Wikipedia and all those sites that anybody can put anything on, but there's some parenting websites from the American Academy of Pediatrics, Mayo Clinic, and the Center for Disease Control regarding childhood vaccines. You can go ahead and take that post-test now. I've included a reference slide for those that I used in today's presentation. Take your post-test and please make sure that you can find the correct answers in this presentation and keep those babies safe. Thank you.